Welcome back to Redefine with DOCN on DYR 105.1 FM. It is now 6:37 on the clock, and we are chatting to the dynamic Dr. Farida Amod, infectious disease specialist. If you have just tuned in, we are now zooming into the recent superbug, which has made global headlines. So the World Health Organization has declared a global health emergency over a new coronavirus, which you must have heard of, the big C virus, that has killed at least 563 people. Following this outbreak in a central Chinese city called Wuhan. More than, I think, 28,000 cases have been reported worldwide, most of them in China's Hubei province. So now the coronaviruses, so we've just discussed HIV as a virus. So the coronaviruses are a family of viruses that cause illnesses ranging from the common cold to more severe diseases such as the recent SARS and the MERS, which is Middle East Respiratory Syndrome virus. Just to unpack all of this further, we have Dr. Amod here, our infectious disease specialist. Dr. Amod, recently there has been anxiety globally on many outbreaks, including SARS, H1N1, and coronavirus. What differentiates all these viruses, and is it possible to actually classify which one is most fatal?
Okay, so I think the reason why the coronavirus has attracted so much attention and why it's spreading so quickly is because this virus normally resides in animals. And so man is an accidental host to the virus. So what happened in the Chinese outbreak is that if you look at their eating habits, they eat a lot of newly killed snakes, bats, animals. So there was accidental exposure. The virus is usually residing in the animals, and there's accidental exposure in humans. Now, this is like completely strange and foreign to our immune system. So the immune system got no memory as to how to contain this virus. So you find that the severity of the disease can be quite severe. Well, there's a range, but it can range from a mild disease to severe disease. But the immune system has got no memory of it. So to try and keep the virus replication rate down is difficult for us. As over time, you'll see, very similar to HIV, when you first get infected, the viral load is very high. As the body gets used to the virus, then you find that the immune system kicks in and the virus gets under control. But with the coronavirus, the same thing, the body is not used to it, it's been exposed, and you can get a fulminant infection from it. Now, what happens is, initially, there's a few core people that are exposed to this market and get infected. But very rapidly, they shut the market down. So how is it that people are now still getting infected, yet they're not exposed to bats and snakes and all of those things? So initially, it was animal to man exposure. But the reason why this virus is spreading so rapidly is now you're getting human to human exposure. So now it's spread via the respiratory route. So if you're in contact with somebody who's coughing or is sick, maybe even very mildly sick, you don't even notice, but the exposure is there and you can get a fulminant infection depending on your immune system. So now most of it, I think in the first month of December, about half of the cases were due to documented exposure to animals. But in January, I think only about 10% of them had exposure to animals. 90% of it was human-to-human exposure. So I think, like you said, at the moment, more than 28,000 people have been infected. The vast majority human-to-human exposure. When you look at, there's a difference between attack rate and fatality rate. Attack rate is if you are exposed to the virus, how many people will be infected? And fatality rate is of those that have been exposed, how many will die? So if you look at the MERS virus, the fatality rate is very high, around about, I think, 30 to 40%. But when it comes to this coronavirus that we're currently experiencing, the fatality rate is around about 2 to 4%. So the fatality rate is not that high, but the number of people infected is far more.
And if you, the H1N1, the swine flu, the talks of all of those viruses?
Yes, so if you look at these viruses in general, what happens is you call them epidemics because they come suddenly, they infect a lot of people, and then they just suddenly disappear. So even if you look at MERS or SARS, they were around for 2 years or so, and then suddenly they disappeared. SARS, I don't think we've had any reported cases for the last decade. So that is the nature of an epidemic, that they infect a large number of people. Sometimes you have the fatality rate is high and they suddenly disappear. But in terms of what can you do to make sure that people are not infected, I think the most important thing is that for people that are infected, they should not move out of that area. And that is what the Chinese government is trying to do, that if you are in that area, stay in that area. And then the second thing that you need to do is to make sure that there are infection control measures in place. So people should be wearing masks, hand washing. Those are all things that will make a difference. So they're simple things. And once you can get, there is something called like a replication rate. It means that if I am infected, how many people will I infect in order for the epidemic to be sustained? And so we need to get that to be less than 1. That means if I'm infected, I will not infect any person so that we can arrest this epidemic. At the current moment for the coronavirus, they postulate that one person is infecting 2.2 people. So every person is infecting at least 2 people in their environment. And now that is sort of feeding the epidemic. So we need to get that rate right down to less than 1.
How are the acute symptoms of coronavirus managed?
Unfortunately for most viral infections, there's no sort of definitive treatment. So there is no antiviral that we can give people that are infected with coronavirus that will work. So most of the treatment is symptomatic. For the people that have a mild disease, oftentimes they're not diagnosed. So I'm sure this 28,000 is not a true figure. The true figure is probably about 4 times that amount, because there are a lot of people that have mild symptoms that won't go to hospital, but they can infect other people. So the important thing is that if you've got fever, if you've got any flu-like illness, and you are in that area, it's best to stay at home or seek medical help. And if you've been exposed or you've been to China recently and you have those symptoms, then you need to go to a hospital as soon as possible so that you can get a definitive diagnosis.
In terms of quarantine of a person or a patient, at which point of acquiring the virus are the patients more contagious or virulent to others?
Unfortunately, they are infectious from the time they develop even the very mild symptoms. And I would say up to about 2 weeks from the time you're infected, you are infectious. So it means that if you do have this virus for at least 2 weeks, you would need to be isolated or stay at home. Otherwise, you are going to spread the disease, unfortunately. In Durban, at the moment, if we do want to do the test, we'll have to send it to a central lab. It's not a test that they are doing at the private labs at the moment. We'll send it to a central lab.
And for some viruses, so you can do a throat swab. What sort of testing would be for coronavirus?
Okay, so most of these viruses, they use something called a PCR, a polymerase chain reaction. So it's also you take a throat swab or you take respiratory secretions and they do a whole panel for coronavirus, for all the viruses. And it's picked up on a PCR test. So you don't really grow the virus as we used to. It's looking for a piece of nucleic acid that tells you that this virus is in the sample.
Dr. Amod, viruses are mutating and evolving faster than we anticipated. Where do you see the future of humanity in terms of global viral epidemics?
you know that there will always be epidemics that come for a period and they suddenly fizzle off. So it's something that historically was there and will continue. Even if you look at the severe flu epidemic many decades ago, and it killed so many people in Europe, a third of the Europe population. So that is something that will always be there. I think the important thing that we need to do is to make sure that our eating habits, our lifestyle, all is in synchrony with or in harmony with nature. And sometimes when people live too close to animals or too close to birds, this is just a natural consequence of that lifestyle.